Hi, everyone, and welcome to another episode of the StrokeSense podcast, where we talk about everything stroke, from prevention to recovery. I'm Sohail.
And I'm Soha. Today, we're taking you behind the scenes of acute stroke care, how every second counts, and what really happens when someone has symptoms.
And today we're honored to be joined by Dr. Lauren Patrick from UCSF.
Dr. Patrick, before we dive in, could you tell our listeners a little bit about yourself and how you came to focus on stroke and neurology in general?
Absolutely. Thank you all so much for having me. Hi, everyone. I'm a stroke neurologist at UCSF, and I specialize in acute care and recovery of patients who've had strokes. I've always been drawn to neurology because it allows us to connect symptoms of what we see in our patients at the bedside and then the underlying biology of the brain. And with stroke in particular, we can intervene in ways that can dramatically change someone's life and potentially save their life. And the urgency of stroke, the teamwork that's required with the doctors, nurses, and emergency medicine personnel, and opportunity to make a difference is what keeps me in this field. It keeps me very passionate about the work.
Thank you for sharing that incredible background. So let's just jump into the process of stroke care, starting with how stroke is recognized and when 911 is called.
So let's begin with the basics. Someone notices slurred speech or an uneven smile, they call 911. What happens in those initial moments?
When someone notices the signs of a stroke, someone has slurred speech or trouble producing speech, their face is drooping on one side, all of a sudden there's weakness on one side of their body, calling 911 is critical. So emergency responders will come and assess the patient very quickly, doing an exam and alert a hospital that the patient is en route. And this early notification allows us to prepare and activate what we call a stroke alert before the patient even arrives to the hospital. Every minute does count. We're not exaggerating. Brain cells are dying with each passing moment. Time is brain, and rapid treatment can help prevent disability.
So, en route inside the ambulance, what's the priority in terms of the patient?
In the ambulance, the paramedics are focused on doing a few key things simultaneously. So they'll check the patient's vital signs, in particular their blood pressure. If their blood pressure is too high, it may need to be lowered with medication. They check their blood sugar levels, their oxygen levels to see if the patient needs support with their breathing, and then try to help determine when did the symptoms start? When was this person last at their baseline? They also began coordinating with the nearest stroke ready hospital, and this sort of hospital pre-notification will help with determining if someone will arrive in time to be eligible for different sort of treatments.
Okay, so let's continue down this timeline. What happens once the ambulance arrives at one of these stroke-ready hospitals?
Once the patient arrives in the emergency department, it's a full sprint. So we immediately bring them over for imaging, usually a CT scan, to see if their stroke is caused by a clot or lack of blood flow or caused by bleeding in the brain. This step is vital because the treatment pathways, if you have a stroke due to lack of blood flow versus a stroke due to a brain bleed, pathways are very, very different. The entire stroke team is involved, and that includes emergency medicine doctors, neurologists, nurses, radiology that read out the imaging. Everyone is working together in real time in order to take care of patients. And our goal is to get the evaluation done as quickly as possible within minutes and initiate treatment within minutes.
So, can you break down the treatment options and the windows that doctors have to administer those treatments to the patient? So, are there medicines given, surgeries? What does the process look like in general?
Yeah, great question. So there are two main types of stroke. An ischemic stroke is one that's caused by a blood clot in a small or large blood vessel, and there's a subsequent lack of blood flow. And then there are hemorrhagic strokes that's caused by bleeding into the brain. For ischemic stroke, we can give a clot busting medication called tenecteplase or TNK if a patient arrives within 4.5 hours of when they were last at their baseline. That's really important to determine when was this person last normal or at their baseline. If you go beyond 4.5 hours and you give medication to someone who has a stroke that has been going on much longer than that, the risk of restoring blood flow, breaking up a clot and restoring blood flow to brain tissue that has already died. It's very risky. There's a risk you can cause bleeding into the brain, and that's very dangerous. So we try to use that 4.5 hours as our guideline there. If there is a blood clot in one of the large arteries in the brain, you can potentially do a procedure called a thrombectomy, where the clot is physically pulled out, and there are doctors that specialize in that. And that procedure or thrombectomy can be performed even up to 24 hours from when someone was last at their baseline. For hemorrhagic stroke or bleeding strokes, the treatment pathway is different and mostly focuses on controlling the blood pressure, bringing blood pressure down, managing pressure that can build up in the brain because there's a bleed there, something extra is taking up space in your brain, and that raises the pressure, and that can be life-threatening. Sometimes people will need procedures like drains put into their brain to help remove some of the blood and extra fluid to help with temporizing that pressure. And sometimes people even need surgeries in order to remove some of the blood and allow room for swelling.
It's incredible that we have all these treatments available. So after a patient goes through treatment, what's the next steps?
After treatment, the focus will shift to close monitoring while you're in the hospital, making sure that the patient remains stable because other complications can come up. And then focusing on diagnostic tests to figure out why their stroke happened and focusing on rehabilitation. So after procedures like receiving clot busting medicine, T and K, or any procedures that are required if you have a brain bleed, patients will usually need to be in the intensive care unit anywhere from 1 day to several days, depending on how much assistance they need. After they leave the intensive care unit, you may go to a regular room in the hospital, and the next few days are focused on doing all of the tests that we need to figure out why a stroke happened. If you have an ischemic stroke, that's due to lack of blood flow. We check the blood vessels to see if there's any plaque buildup that led to it. We check the heart to see if there's a heart rhythm problem that could have led to something like this. And sometimes we look for blood clotting disorders. So there may be a myriad of tests that need to be performed. And then the most important is working with our rehabilitation specialists, our physical therapists, our occupational therapists, and speech therapists in order to see what sort of assistance someone will need once they leave the hospital. Will this person need to go to acute rehab in order to continue to improve and get better? Will this person be able to go home and do home physical therapy or outpatient physical therapy? Will you be able to go home and you don't need any additional assistance because you completely recovered? Our rehabilitation specialists help us with figuring out disposition. Where do you go outside the hospital? What help do you need in order to continue to recover?
So, Dr. Patrick, as a final piece of advice to our listeners, what can people do to support faster stroke care in their community?
That's my favorite question. So one of the biggest ways that people can help is knowing the signs of a stroke and calling 911 immediately. So the acronym FAST, face drooping, arm weakness, speech difficulty, time to call 911 is critical to remember. It's also important to remember to support access to quality stroke care in your community. Sometimes that means we advocate for local hospitals to become stroke centers so that more people can get care quickly, and then encouraging your friends and family to learn about stroke prevention and learning about recognizing signs of stroke.
Thank you, Dr. Patrick, for guiding us today through each crucial step. We truly appreciate you taking time to share your expertise with us today. And thanks to our listeners for tuning in. So make sure to subscribe to StrokeSense for more expert conversations. And until next time, stay informed. And if you're seeing signs, act fast.